My name is Lisa Carnell, and this is my presentation of Beating the Burden, Overcoming Cardiovascular Disease in Malta. I was lucky enough to visit Malta last September and fell in love with this archipelago in the Mediterranean. This is a relatively small country that was under British rule until 1964 when it became an independent country. This tiny island boasts a population of over 545,000 and 17 miles long and 9 miles wide. In this presentation, I will be discussing cardiovascular disease and how it affects the people of Malta. By providing evidence that is supported by the disability-adjusted life years metrics, you will get an idea of this health burden and why it is the leading cause of mortality and morbidity on this tiny island. We will look at the varied risk factors, as well as opportunities available per the Sustainable Development Goals to reduce the prevalence of cardiovascular disease. The purpose of this presentation is to provide awareness of the disease burden and health challenge of cardiovascular disease in Malta. The goal is to inform and join the call for action that promotes accountability and improves lives. Utilizing the Global Burden of Disease Compare tool that measures the health of populations by identifying the most significant health challenges, we are able to see that cardiovascular disease is the leading cause of morbidity and mortality. The disability-adjusted life years, the DALY, is a measurement of the health burden by adding the years of life lost, YLL, and the years of lived with disability, YLD. The risk factors are attributed to either the metabolic risks, such as hypertension, hyperglycemia, and high cholesterol levels, or behavioral lifestyle risks, such as obesity from unhealthy diets, physical inactivity, and smoking, or environmental risks, such as pollution. So who is the enemy here for developing cardiovascular disease in Malta? Malta has the same risk factors for developing ischemic heart disease as in other countries. Per Tilney, the top reasons for the development of cardiovascular disease in Malta are due to a sedentary lifestyle, hypertension, obesity, and smoking. In a study by Mifsud and Galea, there is considerable prevalence in Malta of first-degree relatives with high cholesterol rates, but are asymptomatic. The meaning of the study found an increased risk of first-generational people developing cardiovascular disease, and combined with sedentary lifestyles, poor eating habits, and a high prevalence of smoking makes cardiovascular disease a continued burden of disease. Gaps and limitations in data is a direct result of lack of resources and funding since Malta is such a small region. Also contributing to skewed data is the lack of health information, especially the prevalence of milder cases in association with other disease burdens, or undiagnosed cardiovascular disease or unreported disease. Limitations may also be due to poor estimations of long-term care associated with cardiovascular disease burden, especially on families caring for ill relatives, as well as lack of employment due to cardiovascular disease health. The United Nations Sustainable Development Goals offers a pathway to ending poverty, protecting the planet, and tackling inequalities. The goals are interconnected by three dimensions of economy, social development, and environment. These goals can be applied to the issue of cardiovascular disease in Malta. For example, Goal 3, Good Health and Well-Being in relation to cardiovascular disease in Malta offers the opportunity to raise awareness of cardiovascular disease and to strengthen Malta's health system to care for this disease burden. Goal 4, Quality Education, offers the opportunity to teach the population of Malta to empower themselves to take charge of their health through exercise and diet modification. Education aimed at first-degree relatives with premature cardiovascular disease will aim at reducing prevalence. And Goal 11, Sustainable Cities and Communities, aligns with by promoting the creation of green space for exercise, banning smoking in public buildings, and encouraging organic farming for a more healthy community and healthy food options that aid in the reduction of cardiovascular disease. In conclusion, cardiovascular disease is one of the top 5 causes of mortality and morbidity in Malta, as demonstrated by this presentation and supported by the Global Burden of Disease study. Risk factors are mostly preventable by altering metabolic, behavioral, and environmental risks, stopping smoking, increasing exercising, exercise, and eating a healthy diet. It has been demonstrated that there is an increased suboptimal risk by developing premature cardiovascular disease in first-degree relatives that are asymptomatic, which is of higher concern and more reason to educate of the risks of this disease burden. Global perspectives of cardiovascular disease have a significant impact with an increased economic burden with increased costs related to healthcare, loss of productivity, and premature mortality. For this reason, continued efforts aimed at prevention is key to overcoming this impact of this disease on Malta. References shown support the issue of disease burden of cardiovascular disease on Malta. Thank you for viewing my presentation.